And this is as if Sandra's feet are out here, so we're looking up from the bottom.
Right.
So left and right,
Mm-hmm.
okay? And each slice then is gonna go up into her head, you know, a few millimeters at a time.
Mm-hmm.
This slice, a little bit higher in the brainstem, and we're now seeing the back of the brain called the cerebellum, and that seems fine. It's an area that has a lot to do with different motor functions, but there are many areas of the brain that do that, but this one seems okay. And then we're coming up now into the, what we call the cerebral cortex proper.
Mm-hmm.
Top of the brainstem, this is one temporal lobe, the other temporal lobe, kind of right behind your temples there.
Mm-hmm.
Back of the brain is a visual set of areas called the occipital lobe. And then as we get above the eyes here, you'll see the frontal lobe. And then all the way up top is what's called the parietal lobes, okay? So what I see as I start looking at Sandra's brain, and some of this does take place with aging. Our brains, as we age, do shrink to some extent, but maybe there's a little more shrinkage there than I'd like to see, a little bit. And I see it, here's the temporal lobe, but you can see the front of the temporal lobes are a little bit shrunken in. Generally, the brain is packed into the skull pretty tightly.
Mm-hmm.
That's what makes the skull grow in babies, actually, is that the brain expands over time.
Oh, okay.
So it's really packed in there pretty tightly, a little extra space, you know, probably okay for her age. And then a little extra space on the inner part of the temporal lobes. This is a memory area of the brain called the hippocampus. So there's a little bit of shrinkage in there, and you know, that's something that is unlikely to have happened in the past couple months, may have been going on for some time. Hard to say precisely how much.
And that's age appropriate or not?
A little bit more than age appropriate. Then as we're coming up in the brain, again, a little shrinkage on both sides. And now we start to see a little bit of what I'll call abnormal signal here. So this these whitish areas are areas where there's been a little subtle damage in the white matter and parts of the gray matter.
Mm-hmm.
Often looks like what they'll refer to it in the report as small vessel disease or microvascular disease. If you were able to look at it under the microscope, you'd see changes in some of the small brain blood vessels and maybe some little mini strokes
Okay.
there too.
Those are
And-
what they call TIA.
TIAs.
TIA.
So a TIA would be a symptom of stroke, like the person suddenly couldn't speak or couldn't move,
Okay.
but it goes away.
Gotcha.
Okay?
All right.
And sometimes a TIA, there might be a little stroke underneath that just, you know, the brain dealt with.
Mm-hmm.
But many times the TIA is a symptom of a blockage that then went away.
All right.
Okay? When we see these little spots here, there's already been some damage.
Mm-hmm.
Now, but these spots are so small that in isolation you might not notice any symptoms.
Okay.
But when they build up in the aggregate, then they sometimes will interfere with thinking. Okay? So we're seeing some of that here, and now we're seeing it actually in a few places. So in the white matter in the back, this is a region of the brain called the basal ganglia that has to do with both thinking and movement. And then in the middle of the brain, there's a region called the thalamus, which is, you can kind of think like a set of nuclei or a set of connecting stations that connect different parts of the brain to other parts of the brain. And so we do see a little bit of damage there, maybe an old stroke on the left side. Coming up, we see a fair amount more of those, and more as we go to the top of the brain. So I would estimate, and I think the report says, and I would have to agree in looking at this, that there's a moderate to severe amount of these changes in the brain. It's unlikely that they just came up, you know, in the last 2 months, but they may have been brewing there, and then maybe something additional happened that kind of tipped them over, is one possibility. Let me take a look at some of the other slices.
It had nothing to do with the fall?
Oh, no, I don't think so. this looks pretty good. So each of these scans, each of the MRI scans, are done so as to highlight different aspects of the tissues. And so they get these different sequences. Some of them are better at looking at the fluid, some of them are better at looking at the brain tissue, some of them look for blood, and so on. This one is one that's a little more sensitive to blood that may be in the brain. And there's one spot here where there's probably a little bit of maybe microscopic bleeding, probably very, 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 very small. We can see it here because the scan is designed to enhance it, but I don't,
Microscopic what?
bleeding,
Bleeding.
yeah, but I don't see any other areas of note. You can see that kind of microscopic bleeding in various disorders, but you can also see it in high blood pressure. So even though it's treated, treated high blood pressure is not the same as not having it. And it's a very small spot. I wouldn't make much of it right at this point. Everything else that's here are just other ways of looking at these same pictures. But there's definitely, a fair amount of what we call this microvascular or small vessel disease. And along with that, more shrinkage of the brain than I would like to see. And I don't know a timeline on that, okay? That's all I can tell you from these images. Now, let me just take a quick look. Okay, and all I can say is they did get a set of images here that look at what's called diffusion, and none of these changes in the brain, as far as we can tell in the MRI, occurred within the last 10 days. That's about all I can say. Now, whether those changes in the brain have been brewing there for a few years or a few months or less, hard to say. So I think the concerns then for Sandra is, why has there been this sudden change? What could cause something like that? And then, of course, what to do about it, right? And Dr. Lazar started Sandra, I guess, on the baby aspirin, but that had caused a problem. Is that why it wasn't restarted?
Yeah, I just don't remember the exact reason. I thought it was something with stomach issues or...
Yeah, that's fine. The baby aspirin, which we often use for stroke, tend not to help these kind of little mini strokes per se.
Okay.
So what I would suggest is looking into all of this further. We certainly need the other outside labs that were obtained, and there'll be a couple other labs I want to add to that to see if there's any other reason we would have for these little mini strokes. How is your sleep, by the way?
My sleep is good.
Does she snore?
Very good.
She does snore. Does she?
We all snore.
We all snore.
Our whole family.
Congratulations.
Not me.
Not you, yeah.
Do you ever think she stops breathing at night? Does she snore and then have big pauses in the breathing?
I'm not sure.
Not sure. Blood pressure. Okay,
You think maybe sleep apnea or something?
I wonder. Do you think, are you tired during the day? Do you nod off during the day? No, never nods off during the day. Could she Sandra's sitting and reading or watching TV, does she fall? She does.
Yeah.
Right.
Oh.
Well, so I want you to rate the likelihood that Sandra would doze off in these different situations. And the rating is, I've never seen her doze off in that situation, whether it be a low, a medium, or a high chance, on average. I know it varies day by day. What about sitting and reading?
Sitting and reading,
Never? Or a low
on
chance?
occasion.
Okay, so low chance.
Low
How about TV?
High chance.
High chance. What if Sandra was sitting inactive, but in a more public place? Movie or theater or something like that, or a concert?
No.
She wouldn't
I
doze
haven't
off,
seen-
Oh, yes.
Oh, yeah?
We go to concerts or plays and
dozing there.
She does.
High chance or medium chance?
medium.
Medium. How about if she was a passenger in a long car ride, like an hour car ride, with no break? Would she doze off?
If I'm driving, never.
Really? What if he's driving?
Maybe.
Seriously, maybe a little bit?
We haven't done any long rides in a while, so I really don't know.
No, in the car, she's very alert.
Very alert. How about if she decided to lie down in the afternoon and take a rest? Probably would doze off?
Oh,
How about talking to someone? You ever doze off talking to someone?
No.
How about sitting quietly right after lunch? You doze off after lunch? A little tired?
After lunch.
Tired after lunch? Yes, no?
Yeah, I think so.
Little, okay. And how about if you're driving, but you got stopped for a few minutes in traffic?
No.
No?
Mhm.
Okay, 3, 6, 9, 11. So she's a little bit sleepy. So here's what I would suggest as the plan to look into this. Number 1, there are some additional.
Are we going to get a written
You
summation?
will,
document?
you will get absolutely will get a written summation as I do this. Let's see.
Mhm. Hope so.
What?
I won't remember.
No, I'm gonna write it all down.
I'm
so
sure you
don't
will.
worry.
I'm sure you will.
Now, the shrinkage of the brain, is there something that can,
No, we don't treat that directly, but I will explain.
okay,